Happy Monday, everyone. Now, I left you last week on a bit of a depressing note. What with Medicare being bankrupt by 2026 and total healthcare spending equaling nearly $6 trillion by 2027. So, what are you supposed to do? Now, here's where value-based care comes in. Now, as a provider, it's pretty easy for me to go, value-based care, what are you talking about? I provide the highest value care out there. Let's move on to something different. But I think we must ask ourselves the question, are we really truly providing the highest quality, most effective, and most efficient care to each and every patient that we treat? Do our patients understand their conditions and why following their treatment plan is important? Does that treatment plan include 8 different things to do and thereby compromise their ability to follow it? And are we communicating with their other providers so they know what their patients are being treated for and what tests have already been done? And unfortunately, there are even tougher questions to ask. Does that patient really need to come back every 2 weeks for a follow-up when coming back monthly would be just as effective? Are we referring out to another provider when we who have already developed a very close and trusted relationship with our patients could equally effectively manage that patient in our office, and vice versa? Are we refusing to refer out when another provider might actually provide more cost-effective and more efficient and thereby more truly effective care for that particular condition? Unfortunately, here in the United States, our healthcare statistics don't really back up the amount of money that we spend on healthcare every year. The United States is unfortunately 31st in life expectancy, 55th in infant mortality rate, and have one of the worst maternal mortality rates in the developed world. So I think a question remains that we really do need to ask. Can we, each and every day in our offices, be providing more effective and higher value care? Something to chew on this week. Have a great week.